Welcome to Offscript. Tune in every week to hear the stories of and insights from NPs. We're your hosts, Maxine and Danielle, two technologists who are passionate about the future of patient care.
Our guest today is Roshini Singh. Roshini is the founder of 365 Wellness, a direct primary care practice providing mobile medical services in South Florida. On the personal side, Roshini loves tea time, yoga, and healthy baking. In today's conversation, we discuss Roshini's experience as a direct primary care provider, her tips for other clinicians considering a similar path, and much more. Roshini, thank you so much for joining us. Could you please give us your own brief intro?
Yes, thank you for having me. Well, my name is Roshini Singh. I'm a board certified family nurse practitioner, graduated in 2014, but I was a registered nurse for about 4 years, and I love it. I opened the practice in March of 2021. So I guess we'll talk about that more as time goes on.
Absolutely. Well, thank you so much for being here today. And before we get into questions, in a sentence or two, could you describe what direct primary care is for listeners?
So direct primary care is usually a monthly membership model that where we believe we take out the middleman, which is insurance, out of the picture. While insurance has its place for catastrophe specialists and certain types of procedures and things, we don't feel that insurance plays a significant role in providing the best quality primary care. Primary care is the backbone of healthcare in our nation, and emphasis should be made on providing better primary care, longer time spent with patients, really understanding their case. And direct primary care strives to do that. So we remove insurance, the patient pays us a direct fee to have that time with us, that more accessibility to us, also in an affordable manner. It's not supposed to be on a concierge quote style manner where charging maybe five to $10,000 a year. Usually direct primary care practices are very affordable. It's for everyone. So that's in short what DPC is about.
That is a great overview of it. And thank you for framing it up. I think it'll make the rest of this conversation make a lot more sense. So, our first question is, what inspired or motivated you to launch 365 Wellness?
So it was coming during the pandemic. So we got hit with the pandemic in the United States when we first discovered it around March of 2020. And what we were discovering was that obviously not a lot of patients were going to their PCPs to get primary care access and stay up to date with their conditions and preventative medicine because they were fearful of the virus. So I researched it and I'm like, okay, there's not a lot of mobile primary care offices around. And I'm in Palm Beach County here in South Florida. So I decided, well, we can provide mobile medicine. And then I started learning about the direct primary care concept. I did work for a fellow DPC provider for a few months. So I got to understand it a little bit more and decided, you know what, I can do this and we can use this model and apply it to a mobile care aspect. So that was like the main reason for opening it up because of the pandemic, mobile practice, and then doing the mobile practice tied in with the DPC.
It's super interesting to hear the impact that pandemic had on your decision and on the exact practice formulation. Once you had that vision in mind, how did you actually go about making it a reality, and what was easier than you thought or more difficult than you thought?
Well, I come from an entrepreneurial background, so it was easy to take that leap. And when I moved to this country when I was 18, I think I always had a strong desire of being independent and doing something impactful, but I had to put my years of work in first, of course. I took the risk, I jumped right in. I have a really good support system that encouraged me to do this. That's the first thing. I think your support system, if it's there and they're encouraging you to do this, it's much easier to take that leap. So thank God I'm very blessed that I have that. And if this company should be an S Corp, an LLC, what category, I spoke to my accountant. That was where I started deciding what type of company that this would be. And then at the time I had 12 years of experience under my belt. I knew which EMR I wanted. I knew how I wanted to do this. I worked for a previous DPC provider. Actually, it all came in very naturally. And then from there, every day was a learning experience and I adjusted until now we're 3 years in and I feel finally we're working smoothly.
It's so amazing to hear this evolution. And clearly, you already had a sense of taste about the kind of practice you wanted and how you wanted your operations to go. But of course, to your point, it takes that daily practice of learning and modifying a little bit to get it just right. And now 3 years in, you're reaping the rewards of it.
Right.
I would love to hear how your experience in direct primary care is different from your experience in traditional fee for service medicine.
Oh, well, such a significant question, an easy question to answer. Not to put down my fellow traditional PCP folks that I love. So many of my friends are in traditional primary care settings, but none of them are poor at what they do. They're all amazing. But our system is not allowing us to be the best at what we can be, because in traditional primary care practice, you're required to see a certain amount of patients per day to bill, of course, to earn money for yourself, to pay your staff and all your overheads. It absolutely makes sense. So if you have to see a certain amount per day, which you can't spend that quality time with the patient enough to really understand and get to know them and treat them as a whole person. And giving the best care, I truly believe, requires understanding someone as a whole, their family, who they're living with, their environment, their educational status, what they do for a living, their kids, everything, their nutrition. Unfortunately, in traditional primary care settings, how do you really have the time to discover all of that? Our providers that are in traditional medicine, they do the best that they can, and some of them do it very well and practicing preventive medicine with their patients, but it's really hard and they don't have the time to think about other resources for the client either. At least in direct primary care, you might have the time to think about some alternative methods of care unlike the traditional method. So yeah, that's like the main difference.
Thanks for sharing that. I totally hear you on the ability to have time to think about what is the best option versus what is the most time efficient option really can change the way that you can treat a patient and engage with them. So that makes a lot of sense. And then how would you say your experience is working for yourself different from your previous work experience?
Well, you definitely have a lot of autonomy, which is nice. But then if things go a little south, then everything does fall back on you. And we're a boutique micro practice. So it's not like I have a ton of staff available to take certain challenges that may come up. That's a disadvantage, but I enjoy it and I welcome the challenges and we take care of it. We recently brought over an office manager. So now I delegate certain things to her and she's phenomenal and she's a huge part of our team and our growth. I do miss being a part of a bigger practice with colleagues that I can bounce things off of and have that real family oriented style together. But at the same time, I wouldn't trade it because I wouldn't want to go back to traditional primary care, and I love the direct primary care concept and doing this on my own. Of course, like providing the care must fall within our scope of practice and evidence-based medicine and keeping the patient safe. So it's not like I'm on my own and we're Wild West. We're like still following like a certain protocol and always do no harm, of course.
It sounds like you've experienced a lot of the ups and downs of being a business owner in terms of having great autonomy, but also great responsibility. And sometimes the fact that the buck stops with you is quite challenging. But it also seems like now that you're in a more established place, you're able to bring on an office manager and hopefully build a community as well to have some of the benefits that you had in your previous roles too. Given how unique your practice structure is, we'd love to ask you a few questions about your day to day to give listeners a sense for what it actually looks like to be a DPC clinician. Our first question for you is, how do you actually structure your day in terms of what are the hours that you work and how flexible is your schedule?
Yeah, it's definitely your untraditional hours, and not that every DPC practice does this. My practice is structured really and truly based on my current lifestyle. I'm a mom of two girls, a 4-year-old and a 1-year-old, and we're a mobile provider. So it's not your typical office day that I'm there 8 to 5 and waiting for patients to come in and we book the traditional way. It's really based on, I have to take into account my children and also the patient schedule. But even though there's these inhibitions, we still get out to see patients within 1 to 3 days. Or if a patient needs a telemedicine visit or a phone call, they're getting it that same day, probably within an hour or two. Or if they text us, like we're getting back to them pretty quickly and efficiently. Either the office manager or myself are taking care of patients' needs. Because as you know, a lot of patient care and things we learned with the pandemic does not necessarily have to be done in person. So a lot of it, we take care of it virtually. However, I don't completely agree with only virtual care. If I decide on that phone call or that video call or text that it needs to be seen in person, I'm going to tell the patient I can't diagnose this properly. I'm going to come out to see you tomorrow. Here are my recommendations in the meantime. So the structure of our practice is a little all over. So I can't really say it's structured. We'll schedule accordingly just based on everyone's schedule, between my schedule, the patient's schedule, but we're getting it done at the same time. If there's 3-month follow-ups for diabetic patients, for instance, we're already reaching out to the patient in advance a week prior, for instance, and saying, hey, you're due, I'd like to come out and see you. So we're constantly texting back and forth and making schedules and things like that. If the patient needs to be seen at 6 o'clock on Friday and they say that's the only time, cool, we'll make that work. I'll know in advance and I schedule my life accordingly. So again, it's very inflexible, untraditional.
That makes a lot of sense. And it sounds like direct primary care, plus the fact that it's mobile first, plus the fact that you're very proactive about it, allows your practice to be very flexible for you, but also very flexible for the patient. So, kind of the best of both worlds. In your day to day work now, how much time is spent on direct patient care versus administrative tasks? And how has that changed since bringing on the office manager?
Yes, no, good question. At first it was like everything was on me, but now the office manager takes a lot of the administrative things like prior authorizations, of course, phone calls, texting back on things that I don't really need to be involved with, appointments, reminding patients about blood work the next day, things like that. So I would say it's like 50% of the day I'm doing direct patient care, and the other 50% is just running the business from a different angle, like meeting with specialists, meeting with other ancillary healthcare providers. In DPC, an important part about us is networking and networking with other healthcare professionals because we have to have resources for our patients. So I'm doing that part in the meantime while I'm not doing direct primary care. Or I'm like reading journals literally because I have to stay up to date on patient care. I'm looking at our accounts and talking to our accountant, our attorney. So I'm doing that business side the other 50% of the day.
It's really cool to be able to balance your day that way. And it sounds like it's really for you. How would you compare kind of splitting your time or splitting your brain space between that clinical work and that more entrepreneurial work?
I don't know. I mean, that's such a good question. It just has to happen naturally. I'm forced to do it because this is my business and I have to be able to compartmentalize back and forth constantly on a daily basis. And it's a passion for it. I think you have to really love being a business owner and understanding what that entails. And I love being a clinician. So I think the first and foremost thing to handle this is your love for it. And if you have a passion for it, you're going to make things work and you're going to make it happen.
Leading from a place of passion and working from a place of true commitment to the craft of both of those things, that feels like a very good takeaway. Can you provide, in broad strokes, examples of the types of patients you're seeing on a daily basis?
It varies a lot. So we see pediatrics to geriatrics. Now, pediatric clients up to age 18, we don't take over as the pediatrician. I strongly believe that the pediatrician, they've studied for longer, they're more experienced with children, that our children in the practice should always have their pediatrician. So we are like an add-on for the parents. Let's say the child needs to be seen for strep throat, a rash, otitis media. Those are very common things that they'll reach out. So our price point is lower for our kids under 18. Now, when it's from 18 and onwards, we become the full primary care provider because we believe we have the scope of practice to do so in because we've studied family medicine. So it's very wide. It ranges from patients diabetes, cholesterol, COPD, renal disease, heart disease, asthma, and all the acute conditions that come with it, a UTI, bronchitis, STDs, preventative medicine now like, fulfill all of that. Their mammograms, all their blood work, review, all those things. And we do have very complex patients to very simple patients. We have patients that just has high cholesterol, for instance, and maybe they're on something for their depression and we manage them. We probably see them every 4 to 6 months and they reach out in between for acute needs. They have the flu or COVID or whatever it is. And then we have the most complex patients ever with 10 to 15 chronic conditions with 10 to 15 medications, polypharmacy we're trying to deal with. And we're in between talking to the specialists, faxing records over, back and forth, reviewing, ordering labs that the specialist would need. And it's a weekly type of contact that we have with those clients. So it could range very complex to very simple.
That makes a lot of sense. And just the fact that there's such a broad range in terms of ages, in terms of diseases, and also in terms of complexity is, I imagine, very interesting, but also very challenging. And it probably also has some implications or some questions as it relates to price and to some extent the value that patients are getting from the service, in the sense that some patients are probably utilizing your care a lot more than others. And how do you think about the price point with that in mind, and the fact that utilization will naturally vary?
Yes, another good question. So at first, like because the business experience with this and I was still learning how to do this, the price point was the same for everyone. But what I slowly realized probably in my second year was that gosh, how can I have the price point the same for everyone when some require a lot more time and attention, reviewing notes, speaking to specialists, checking in on them more often. I'm seeing them more often. I don't think that's fair. So we do have different price points for patients that have a certain medical history. Every patient that enters the practice, they're vetted. Like we speak to them in advance, and we already have the experience to understand what their care is going to entail. So right off the bat, we're already speaking to them, and we decide this is the price point that you're going to fall at, because I strongly believe that this is the money we need to earn to properly take care of you.
It makes a lot of sense to be transparent with a patient who might be more complex or who might be more simple, to be like, hey, this is what is appropriate. And everyone then feels like they're getting a good deal and really getting the value that they need.
Right. And, just to mention, direct primary care is another big part of it is being transparent with your costs and everything. I mean, I would not be following this model properly if I didn't tell patients upfront, like, this is what it's going to be. That's lacking in our current healthcare system. Is getting better, like, it's being recognized by our government that needs to be there. Like, there's the Price Transparency Act that came out in year 2021. If you go on a hospital website, you can see like prices of certain things. It's getting better, but it's not there yet. DPC, we can afford to do it a little bit better because insurance is out of it.
It's definitely getting better in the traditional healthcare world, but it's not even close to the transparency that DPC has. More tactically, I know you mentioned that you're managing a lot of care over text or over phone call. I'm curious how your day or how your care is split between house calls, video calls, phone calls, texts, and emails. If you have a rough kind of breakdown, I'd be super curious to understand.
If I have a schedule for today, and it's not every day that I'm out seeing patients, it could be on average 3 days a week. So the days that I'm out seeing patients, it'll be scheduled like patients will be scheduled every hour and a half. So it gives me time to get to their place, spend at least an hour. Actually, you know what? It's an hour and a half to 2 hours. So to spend that good quality time with them, at least about 45 minutes, and then I can leave and go on to my next client. And then I'll try to strategically schedule where certain patients in certain areas, I'm driving to Boca Raton and seeing Boca patients there. I'm not kind of driving all over the county up and down. And then in between patients, I'm in the car maybe for 30 minutes per appointment. So I'll take calls then. Like if a patient needs something, I'll jump on a call with them then, or get on the phone with my manager or my medical assistant and tell them, can you tell the patient, like, I'll call them back at 5, or here, go ahead and refill their medication. So we're constantly in contact on the road. So I'm literally seeing patients and caring for them while I'm driving and then stopping off to my appointments. But I mean, that's just how it is, and it's fine. It really works. And then I have a back office team like to help. So yeah.
It's awesome how dynamic you are and also how efficient you are in terms of making the most of every minute that you have to deliver the best care to your patients, and then also tapping in your team when it's appropriate to do so. So it sounds like you've really built a system that works really well, and big kudos to you for that. You've touched on a few elements that I think make your role and your setup pretty unique, but would love to hear a bit more about what are the specific aspects of your work that you find most rewarding or most challenging?
The most rewarding is that I can spend more time with the client. I think it's so beautiful. I love getting to know these patients on a different level. And especially, I have the unique opportunity to see them in their home and someone's environment. There's countless studies that show that patients in their own environment, they more feel comfortable to speak to you for a longer period and tell you more. Also, a clinician can tell based on a patient's environment where certain things might be coming from. I'm walking into a home that's like very chaotic, or there's lots of alcohol or whatever. You can tell that aura and energy as soon as you walk into a home, and that matters to their treatment plans. You can more see like how their child is reacting. Let's say they're living with an autistic child or a mom who has dementia. All of this will be included in my thoughts on how I'm going to diagnose and treat. So that's the most beautiful part of this. The challenging part is I don't know if there's a challenging part to this. I can't say that there's a challenging part to direct primary care. I'm just obsessed with it, and it's the best thing that's ever been created in medicine.
I love your mindset and I love your approach to it because it's so clear the level of gratitude and awareness you have of the thing that you love to do. And it's a great answer when you ask someone what challenges in their job are and they say none. That's really amazing.
Yeah. I would be lying if I said there's no challenges. Of course, transparently, the challenges are dealing with patients with complex conditions, the families involved. You are that one point of contact to help them make this decision. Just the other day, we had to help a patient's decision and family involved on if this patient should now move off into palliative and hospice care. We have to sit down, decide if this is the next step. It's very emotional and it's very stressful for the family. And that is a challenge for us, but we take it. That's what we're supposed to do. This is the job that we signed up for. Well, it's not a job, it's our career, it's our life. We dedicate our life to this. We dedicate our life to patients. So I would be lying to say there's no challenge. Of course, anyone in the medical field practicing as providers, there's always going to be challenges. There's stress that comes with it. But this is what we chose and we're committed.
Definitely, and what you continue to choose as well. And it sounds like patients are some of the best parts of the job, but also naturally some of the most challenging parts as well.
Thank you so much for sharing all of that. We want to move into asking you some more business tips, given that you're an entrepreneur and we think our listeners can learn a lot from you. So, wondering what tips you have for determining if there's interest in your services and how you thought about that for 365 Wellness.
Yeah, the marketing is definitely hard because we're so ingrained in our society that insurance has to cover everything, which naturally I don't blame patients for thinking that way. So the marketing aspect has to come to touch somebody where they realize like, oh yeah, I need this. I understand why I would have to take out additional money to pay for something like this. So the marketing is unique. The marketing can't be by your typical SEO. It has to be done by relationship building and being out there and talking about what you do and the impact. That's why social media will be very important. And a business owner getting into this should be out there networking, talking, joining associations, getting into country clubs or just HOA communities to talk about what they do. I honestly believe that's the only way, I think, in my opinion, to be successful with this. If you're out there networking in a strategic manner.
Definitely, that makes a lot of sense. And it seems in part being a DPC provider is a bit challenging because you're at the same time selling DPC and also selling yourself as a DPC provider. And there's a lot of education that needs to be done. But it seems like a lot of DPCs have kind of overcome that challenge by, to your point, really getting into their community and building relationships, building the trust. And that's such a foundational element as well. You spoke a bit earlier about changing your price point at some times after you realized that you were underpricing certain elements. I'm wondering if you have any advice for clinicians considering a similar path as they think about setting their initial price.
My price point was initially developed based on looking at other DPC practices. So, like in real estate, when you look at comparables of homes and things like that, it was a similar aspect. So, you're looking at what the other practices offer and what their price point is, and you determine what you offer and compare and then come up with your price point. So, it's basically based on like comparing other practices, how I came up with my price point. But still, I was in a unique position because not a lot of DPC practices are mobile. So I think in a way we had to set some sort of standard. I utilize price points from other DPCs that see patients in office, but I had to adjust it a little bit differently because we're mobile. I believe we were the first mobile practice in our county. I could be mistaken, but we were one of the first at least. So again, there wasn't a lot of comparisons to be made.
That makes sense in terms of looking at the broader market, but also tailoring it to your specific case, given there were elements that made you quite unique and quite new as well. You spoke a bit earlier about how patients can be some of the more challenging elements too, especially when you're delivering difficult news or making a difficult decision alongside patients. And one of the common concerns that we hear from clinicians as they're exploring direct primary care for themselves is the fact that there might be a lot of inbound from patients and it could be a bit overwhelming in terms of them not having time for self-care for their families, etc. I'm wondering how you approach establishing boundaries with your patients and making sure that you're still able to take care of yourself.
As you get to know your patient and your patient gets to know you in direct primary care, you become family with these patients. And as time goes on, this trust is built. And because of that trust and that strong bond that you have with patients, having this open communication in a compassionate manner but respectful, it's easy to indirectly let patients know that there are boundaries. It's hard to say what your boundaries are right in the beginning of meeting patients. It takes time to develop those boundaries only because it takes time to develop this trusting relationship between each other. Does that make sense?
It absolutely makes sense. And boundaries are something that once you know someone, then it's from that open place, then you can have those kinds of conversations. But it feels like there's this like trust building that it sounds like happens in the beginning that then allows the conversation about boundaries to come up.
Exactly, exactly. We need to put that time in. Yeah, we have to understand human beings and how they're going to react. And if we have that understanding, we'll be okay. Hmm.
Totally agree. That's probably a broader life tip as well. A big part of DPC that is really attractive for patients and that clinicians tend to really like is that they can offer lower cost services to patients like on labs and imaging. Wondering if you have tips for getting access to those lower cost services.
Yes, absolutely. And this is where the relationship building goes again. And you talk to different labs, you build relationships with the representatives, you discuss provider pricing. Sometimes there's a little wiggle room for negotiation because when it comes to self pay, there's a way easier negotiation for self pay compared to negotiating prices with insurance because insurance, it has the third party involved. Building those relationships are important.
Absolutely. And sharing the kind of service that you're delivering also can make it an easier conversation, it sounds like. And finally, wondering if you have tips on delivering value to your membership patients month over month, given that there's that monthly membership fee. So, month one, it feels really clear what that value is. What is the value in month 12 or month 24?
Well, I've had patients that were with me since the beginning in 2021. I've had some that left. I had some that came back. Based on the statistics, that a lot of patients end up staying for a long time. Like once they pass over that 6 months and they really see your stuff and what you can do within those first couple of months, it's really hard for them to leave. Because it's hard for them to leave and they've stayed on with us for such a long time, that's what answers the question to the value. They see the value, so they're staying on. A lot of times we have patients leave because of affordability, something's changed in their life, or they've moved away. Those are the two top reasons. It's very unusual that a patient leaves because they don't really like us or what we do. But of course, you're always going to have patients that are unhappy with something. That's being transparent. Like, I'm not going to say, oh, everything is perfect and the patient's going to love every single thing we do. Some patients, maybe we're not the right fit for them, and that's okay.
Yeah. The fact that changing life circumstances in terms of moving away or losing a job, the fact that that's the most common reason for churn is, I think, a really good indicator for the value that you're able to bring personally, and also that direct primary care as a concept is able to build as well. To close, we'll ask you the same two questions that we ask all guests. The first is on the healthcare system more broadly, and the second is just advice that you have. So, on the first, what changes would you like to see in the American healthcare system to improve patient care?
I definitely like to see, if possible, that clinicians have more value quality time with a patient because if they have more time with a patient, they can talk more about preventative health. And where is the crux of all issues? It's on preventative health. If we were to spend more time doing that, then conditions would be less severe for the most part. You're going to do your best, less hospitalizations, less healthcare dollars being wasted. So I think it comes from that core. If we can spend more quality time with the patient and more integrated healthcare where records are easily shared, like there's an automatic response. If a patient is in a hospital, automatically it needs to be sent to the primary immediately, not a week later, so we don't see what's going on and we can't get on top of it, but right away. The system should be a protocol right away, send to primary, send to primary. I think the same with specialists. Like they see a patient, it should be automatic in our system. If more time can be spent with the patient and there's more transparency between specialists and hospitals sending it to the middle person, which is the primary, I think we'll be better off. I think that will improve healthcare significantly.
We've So agree with that. And just thinking about the primary care provider as this like context holder and real caretaker of the patient across all the different parts of their healthcare journey, and imagining a system, whether it's technology or services that allow for that, would be so transformative and would get at the root cause of so many of the issues that are often communication or administration issues. Our last question is, what is some advice you want everyone to hear or to walk away with? And note that this can be clinical or non clinical.
Advice to walk away with, this is going to sound simple, but really love what you do. Because if you don't love what you do, you can't impact patients, you can't impact communities. Be authentic and love what you do, and know whatever it is that you choose to do it with passion, because society deserves that from you. Just follow what you're good at. That would be the advice.
That is really, really good advice to walk away with. That society deserves you to love what you do. And it's a beautiful thing to think about a world where everyone is really stepping into the thing that they love and being able to do that. So, thank you so much for your time today, for your wisdom. This was an amazing conversation, and it was so great to get to talk with you about all of this.
Yes, it's my pleasure, and thank you for the opportunity. I really appreciate this time to speak on all of this.
Absolutely.
Thank
you.
you.